We come together today as state COVID cases pass the 250,000 mark. New numbers are just in up today as well, and some of our neighborhoods are the hardest hit. Major changes this week meant to stem the tide drew some major blowback. The leaders making those changes are here live with us today. In Miami-Dade, collective hospital capacity is now in red flag territory. The mayor this week made some decisions, some revisions, and orders that drew both support and protest and raised a lot of questions. Mayor Carlos Gimenez is with us via Skype to answer as many as we can get in. Good morning, Mayor.
Good morning, Glenna. How you been?
Great, thank you very much. Let's start with the rollbacks that you did effective on Thursday. Again, closing indoor restaurants, closing entertainment venues where people are going to be close together, possibly maskless, sharing the airspace. The fitness centers closed were allowed to reopen after a compromise that it would be masked all the time for everyone inside. But the biggest criticism I'm sure you've heard is that these were actions taken absent of some real scientific data that these places are actually responsible for the spread. So why did you make that decision? Address that if you would.
It's not absent that scientific data. Look, on the interior spaces of restaurants, it's the only thing that I know that you have to take your mask off to actually do the activity. You have to take your mask off to eat, to drink. And now we have a positivity rate of over 25%. When we made the decision to open the restaurants back in mid-May, positivity rate was about 8%. And it's interesting that some of the people that criticized the decision to close them again actually didn't open the restaurants until 10 days after we allowed it in the county. And so some of those people must have been really concerned about opening the restaurants, and then now they're unconcerned about closing the restaurants. And so
well,
look,
if I may, because I've spoken to so many of them, they're not unconcerned, and many of them truly understand that there have to be changes made. I guess the biggest question is gymnasiums, fitness centers, gyms got an opportunity to make some compromises. There is no real scientific data that restaurant patrons were responsible for this uptick in numbers at this point. Although the science that you're citing in the guidance makes perfect sense, but why not give businesses like that a chance to figure out a way to be safe?
It's impossible to figure out a way to be safe in an interior space when you have a 30%, 25 to 30% positivity rate when you have to take your mask off. The problem, it's an interior space when you take your mask off. That's the issue. Look, the analogy that I gave the other day is it may be perfectly fine to take a curb at 50 miles an hour when it's dry pavement. But when you have wet pavement or you have snow or ice, you got to slow down. The positivity rate in Miami-Dade County went from 8% to over 25%. That means the probability of somebody in a restaurant being with you, having the virus is much higher today than it was 2 to 3 weeks ago. Nobody said that restaurants were the only reason, but it is an unsafe act. That's why restaurants, the interior spaces, had to close. That's why, when we sat down with the restaurant industry, said, okay, the outdoor spaces is okay as long as we follow the rules that we had set up. Gymnasiums, they have to wear the mask indoors. You want to do some kind of activity that you can't wear a mask in, you're going to have to do it outdoors. You cannot do it indoors.
So let me ask you this: how then? How is this so hard to enforce? Thursday, we were visiting gyms. We saw through the window people wearing masks underneath their chins. Certainly, my intention is not to shame anyone or point fingers, but I think that's a snapshot of how difficult these rules are to enforce, absent 100% of the people taking personal responsibility. How does that happen?
It's very hard to enforce. Obviously, we saw images on restaurants, et cetera, that and social activities that were happening that were completely violating the rules that obviously did. It's up to us to do the right thing. It's up to us. The government only can say, look, you should do this, 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 and this. At the end of the day, it's going to be you and I and everybody else in this community that has to have a sense of civic duty to do the things we need to do in order to drive this contagion down. And our positivity rate has gone through, from 8% to over 25%. We have our we've seen that our hospital bed and our capacity is starting to, dry up because we have so many more people that are in the hospital. What we're trying to do is drive the positivity rate down so that we don't get to the point where we're overtaxing our health system here in Miami-Dade County, and then we have needless deaths.
Certainly that is
Yeah.
everybody's goal. Totally understood. Let's talk about contact tracing. Really, one of the top things that from the get-go, there is no dispute that I've heard that contact tracing is the method, the process that will be one of the only things for a community to get a handle on and to pinpoint where the spread is happening. And yet, this week you announced the county is getting 250 additional contact tracers. That's good. But really, Mayor, it wasn't until this week when you were with the governor when he was in Miami, and you were really pressed by our colleagues. Christina Vasquez was a reporter asking some of those questions. Where have the contact tracers been until now, and who really is responsible for tripping that into action?
Well, there's no controversy of who's responsible. It's a state. I mean, it's called the Miami-Dade County Department of Health, but it doesn't belong to Miami-Dade. It's a state agency, and contact tracing is a state responsibility, and it's their purview. What we have done here in Miami-Dade is we will pay $14 million to add another 250 contact tracers here in Miami-Dade County, but that will work for the State Department of Health. And do we need more? Yes, we need more. But what's interesting too that we've been finding is contact tracing actually works when you start to drive the contagion level down. There's so many people right now that have this virus that contact tracing, what we really want to do is get these people up to speed so that when we start to drive the rate down, the contact tracers can actually do a much better job of pinpointing exactly where this thing is at. Because right now, this thing is just about everywhere. It started out in 33142, 33125 in the city of Miami, really hot spots, and down in South Dade. But now we see our map is basically orange just about everywhere in Miami-Dade County. And so we're glad to get those contact tracers down. The state is adding additional contact tracers down, get them on board, change the form so we get a little bit more in-depth information from those people that are positive. And then once we start to drive this down, which these measures that we put in place last week and this past week, we won't see if those measures work for another 10 days or so. When we start to drive those down, and then those contact tracers can really do the job and start to pinpoint exactly where it's at, and then try to get those folks that may have been exposed to also, take the exam. But look, all of it, the only thing that's going to really work is our behavior and changing the behavior of the people of Miami-Dade County, taking this very seriously, especially the young. They can't keep going to parties and thinking that everything is okay. And I think that was probably the message that they got back in early June, that, hey, everything was okay. We can go out and start to party. We can hang out with our friends. And then the positivity rate among the young skyrocketed. Now it's spreading to the rest of the community. We have to take action. We have to do what's right. We have to take personal responsibility. That's the one thing that's really going to beat COVID-19 here in Miami-Dade.
Point well taken, and I hope everybody is listening to that. I want to ask you about the $138 million from the CARES Act, from the federal funding that was sent to Florida. Of that, it was distributed to counties based on need, and that need, from what we understand from the state, was delivered by the different county health departments. So Dade County Health Department transmitted what was needed, and Dade County got 19.5 million of that 138. I'm going to read the list of things delivered: 6 epidemiologists, 84 contact tracers, 400 nurses. And while that is all on very positive news, Broward got 50% more than Miami-Dade, 30.5 million, and a list of those things. And certainly Broward is suffering, but the numbers are much higher in Miami-Dade. Would you put that into context for us?
Well, I mean, I didn't put the list together. Again, that went to the department. What I hate about it is it says the Miami-Dade Department of Health. That's not Miami-Dade. Okay, it's a state. So you need to talk to the head of that agency down here in Miami-Dade as to why, it is that if they got everything that they asked for, they should have gotten more than Broward County. I agree with that, and I'm also, I'm grateful that we're getting the extra nurses and help here, because really that's what we need in order to open up more of our hospital beds. We have more reserve capacity that we need to open up, more reserve capacity with ICU beds, more reserve capacity with the critical care, but we need the staffing for that. That message has been relayed to the governor. He gave 100 nurses to Jackson last week. Hope to get additional nursing personnel here in Miami-Dade so that we can open up more and more of these hospital beds as we get closer and closer to capacity.
Yeah, and real quickly, I know that so many parents we are a month away of what may be the beginning of a school year, and I know you and the superintendent have been hashing out some kind of option, something, in the purview of listening to state and federal education authorities say we must open. Update us, if you would, on what Miami-Dade parents can expect next month.
Well, the superintendent and we met last week. I know that they have a plan. We spoke again actually this morning. We ran into each other. And it's critical. Look, it's going to be based on what's happening here in Miami-Dade County with the virus when it's time to open school. And so we spoke about it, and we need to have different options depending on where we are with the virus. If the virus is at this level still, 6 weeks from now, no, I don't think he or I would be comfortable with a back to school, scenario. It's more of a virtual school scenario. But if the virus was at a much lower level, maybe you could have the option of some, children going, back to school, back to the actual physical school, but we're not there yet. And so he and I,
a lot to do in the next month is what we're hearing. A lot of decisions still to be made.
Yep.
Mayor,
yep.
Great to see you and appreciate your time, value your perspective. Thanks for being with us today.
Thank you. Thank you, Glenna. Have a good one.
Thanks, you too.